Hi everyone, my name's John. I'm a PGY3 neurology resident here at Ohio State, and I wanted to share with you a few reasons of why I chose Ohio State to go to neurology residency. One of the biggest reasons was the culture of encouragement and teaching that we have here, and that comes from the leadership and from the attendings. Our attendings take the time out to do bedside teaching of neurological, physical exam findings. They make key points on rounds. They'll meet up with the residents later in the day as well to go over lectures. And they've also supplied us with a plethora of learning resources that have really helped us, and I think has been one of the main reasons of what led us to scoring one of the highest right exam scores in the nation. And that's the residency and service training exam that we take every year. Another key aspect that I was looking for in a residency was that I wanted to see a wide variety of pathologies and to get exposure to numerous subspecialties within neurology. And that was mainly because I wanted to make sure that I was prepared coming out of residency to become an attending and to know for sure, if I wanted to do a fellowship or not. At a large academic institution like Ohio State here, we definitely see a wide breadth of patients, and I've really enjoyed getting to get a lot of exposure into the multiple subspecialty clinics. Just briefly, for example, like for stroke, we have one of the highest volumes of patients in the nation. We have 27 spoke hospitals. We also do numerous thrombectomies. For epilepsy, we have multiple months in the EMU where you can work on reading EEGs, seeing patients, and then we also have some opportunities to get in on epilepsy surgeries, which has been really interesting. For movement, we have a lot of opportunities to get into the clinics there as well. We have conferences every month where we go through videos, which has been super helpful. And we also have availability to get into DBS as well if you're interested in that. For neuromuscular, we have months in the EMG lab where you'll be doing nerve conduction studies, the needle examinations under supervision. We also have exposure into subspecialty clinics like the MDA clinic, which is at Nationwide Children's Hospital, one of the best pediatric hospitals in the nation. And then, for one of the other big specialties like headache, we have an amazing specialist here, Dr. Weber. He does a great job teaching us, getting us, we get plenty of exposure to all the common headache symptoms and pathologies that you'll see, as well as the more rare ones. And you can also learn Botox for chronic migraine and even occipital nerve blocks if you're interested. So another main reason of why I chose Ohio State was because of our program coordinator, Karen. She is literally one of the nicest people that you'll ever meet. She really has made everything in residency just go so smooth. Everything runs through Karen. She knows everything that's going on. So if there's ever a question, we know to go to Karen, and she responds back very quickly to all of us. I think the program coordinator is a really important aspect when looking at residencies because you're really going to be interacting with them very frequently. And Karen's definitely one of our strong suits here at Ohio State, and I couldn't imagine our residency program without her. Now, the city that you live in is also a big aspect when choosing a residency, and there's been a ton of things that I've loved about living here in Columbus. For me personally, I love sports, so it's been a lot of fun either going to the OSU football games or watching them on TV. We also have the Columbus Blue Jackets, Columbus Crew, other sports teams that you can go to as well. We have the Short North area, which is like a bridge in between the campus and the downtown area. They have tons of restaurants with a wide, diverse selection of food. They have art galleries down there. They have a gallery hop like at the first of every month that you can go to. We have numerous concerts that come into town. There's also a lot of hiking and biking trails in the area. The closest one to campus is called the Olentangy Trail. It runs right along the Olentangy River and goes right past the hospital. So those activities may be more suitable now and during the COVID pandemic, but we definitely have plenty of hiking and biking trails, which I've really enjoyed while being here. So in summary, for me, I wanted to choose a residency with a great culture of teaching and encouragement, one that would set me up for success for the boards, success for beyond residency as an attending or in fellowship, one with a great program coordinator, one with a city that I would just enjoy living in for 4 years, and I definitely found all of this here at Ohio State.